For more on the impact of TB across the continent, especially, I'm joined by Dr. Jean-Louis Abena from the World Health Organization. Dr. Abena, thank you for your time this morning. It is an important day, I think, globally to shine a light on TB and its impact in communities and, of course, on the healthcare systems as well. We were listening to our health minister a little bit earlier on say this is preventable, this is treatable, this is curable, but just lamenting the fact that the message doesn't seem to be having the impact that it needs to have in communities. And I'd love your insights as to why that is the case.
Yes, so this is a tricky question just to start on, and thank you for calling me for this celebration. So the Pro-African has made a lot of progress in the fight against TB. So we are talking about the 24% TB cases that are missing in the region. So if we can diagnose those cases, then we will be near our objective of eliminating TB by the year 2013. And there are a lot of many factors that can result in a non-diagnostic of TB. The first is that technically the TB is difficult to identify as a physician. If you don't have the full-blown the picture of TB, coughing, sweating, spitting blood, is very difficult. So in some time you have kind of general symptoms that are not really indicating the medical doctor or the health personnel that it might be TB. This is one problem. There's also people who do not have access to healthcare at all. We know that once you have been diagnosed as a TB patient, you have free treatment and free follow-up. But before that, you need to endure the cost of the diagnostics. So there are a lot of out-of-the-pocket costs that it can refrain people to get diagnosed. So these are issue of access. So we can have financial barrier. We can also have geographical barrier or other social barrier like stigma, country in instability, or sometimes a country with stock out of diagnostic or treatment. So these are major factors that can make that we cannot diagnose the TB case or notify the TB case. So we are really concerned about those missing cases. Yes?
Yes, and when you consider the impact, the numbers in South Africa, 80% of HIV deaths are TB-related deaths. There is the issue of people not staying on treatment, so they'll start the treatment, start to feel better, abandon, and then become resistant to those, and you develop things like multi-drug resistance or extreme drug resistance to TB treatment protocols. So that is concerning. Maybe we can come back to that a little bit later on. But it continues to kill people across the African continent. So just telescoping out of the issue we have in South Africa, just talk to us about the profile of tuberculosis and deaths across the continent. Again, just to bring in that this disease collectively kills more people than bubonic plague, smallpox, and COVID-19 combined. That is a staggering amount of people.
Yeah, so the number stands as follows. So in the region last year, we had 2.5 million TB cases, and we have identified 1.8 million TB cases. Though the missing cases, I've made the calculation, it was 24% missing cases. This is a concern. And TB is driven in the region mainly by HIV. Especially in South Africa, majority of TB cases are co-infected. But HIV is not the only driver of the TB epidemics. There's also malnutrition. And there are also other factors that can contribute to TB. Overcrowding, this growing urban population in Africa is also a concern. So we need safe and clean house. So these are factors that are contributing to the expansion of TB. And the mortality is very high, and this mortality is largely beared by people living with the HIV who are co-infected. So the South Africa and other countries have taken a step ahead on preventing those deaths by putting all the people living with HIV on preventive therapy. But people living with HIV have a lot of issue, the burden of pills, they have to take the medicine. They need social and mental support. So sometimes it is not a physical disease. Is also part of mental disorder due to this long illness. So because when you have HIV, it's a lifelong journey, and you are struggling to survive. So there are many factors that contribute to these some poor outcome. But South Africa has been also in the forefront on this DRTB we're speaking. So in South Africa, they made all these clinical trials that demonstrate that we can treat TB, MDR TB with shorter regimen, and the results are promising. And South Africa has succeeded to reduce by half the incidence of TB in the country. And South Africa and Nigeria bear the bulk of the TB epidemic if we see Africa as a region. So the progress in South Africa and the progress in Nigeria and other Southern African countries has led to the reduce of the incidence. We had, if we compare at the level of 2020 and 15, a reduction of 24% of incidence and mortality by 42%. So there are good results. So the number of deaths is decreasing. The number of the TB cases is also decreasing. But these missing cases are also fueling the epidemic. And we didn't succeed to also contain the HIV epidemic and so also the poverty. But we are joining our effort to give TB prevention, make contact tracing and all the intervention to be very aggressive against the tuberculosis microbe and give him some antibiotics to really sterilize the patient and the population.
Yeah, Dr. Abena, I think it's worthwhile going back to just a reminder and the messaging around TB. It's asymptomatic. You might not know you have it, and you're carrying it and giving it to someone else. So just reinforce the message around testing, and notwithstanding all the barriers you've just shared with us now, what the treatment looks like. Is it manageable? So if people get tested, realize or are diagnosed with TB, is the treatment regimen manageable for them?
Yeah, the treatment is manageable because we have fixed dose combination, so the burden of pill has been reduced. For the preventive therapy, the duration of the treatment is already shortened. We have short regimen for preventive therapy. You can have 12-week treatment and even 1 month. So we are going towards the reduction of the length of the preventive treatment or the curative treatment. For the MDR-TB treatment, we are coming from a 24 months of treatment with painful injection and as it has been replaced by all oral treatment and a 6-month all oral treatment with reduced number of tablets and less side effect. This side effect was one major cause of non-completion of the treatment. So it's manageable. But we need to focus on certain category. People living with HIV should take their preventive therapy. People living in the neighborhood or in the household of someone that has been diagnosed with TB should be screened. And if there's no symptom, it should take preventive therapy, and especially for children, because technically diagnosing TB in children is a big challenge, and the children are a large part of undiagnosed TB, and this is a real drama. So it's not easy to find out that a kid has a TB, and it is a matter of concern. The diagnosis of TB in children. And another at-risk population that does not have access, according to our data, are the seniors, the people above 55 years, maybe because they don't have, they cannot afford to go to the hospital, but we need to prioritize these elderly people and infant as priority population also for screening. So young adults are known to have TB, they have means to come to the hospital, and we really need to take care of all the population and to find each and every case of TB. Be aggressive on contact tracing, because TB is an history of contact with someone who was infectious. We need to find where the source of contamination was. Over.
All right, Dr. Jean-Louis Abena, thank you very much for the update there, Technical Officer for TB at the WHO. It's so important to get that testing underway. And as you heard there, the treatment regimens are a lot more manageable as medicine has modernized. And this is a scourge that continues to visit homes all across the African continent. It is detectable, preventable, treatable, and curable.